brought some members together to share some really good news that's happened on Vancouver Island. I want to first of all, of course, acknowledge that I live and work on the ancestral territory of the Coast Salish nations, in particular the Lekwungen-speaking nations of the Songhees and the Esquimalt. People joining me here today, Avery Broman is the Executive Director of the Victoria Hospitals Foundation. Also joining me today, Dr. Omar Ahmed, who is the Head of Emergency and Critical Care for Island Health. Joe O'Rourke is the VP and General Manager of the Victoria Seaspan Shipyards. And Carrie Homuth is the Manager of Intensive Care in the Acuity Unit at Victoria's Hospitals. So Avery, an amazing announcement yesterday. Tell me what that was.
Well, yesterday was a very inspiring day for the entire Vancouver Island community. We announced a $2.65 million transformational gift from the Victoria Seaspan Shipyards and the Dennis and Phyllis Washington Foundation. And that gift truly advanced our critical care campaign forward. So as you know, Bruce, in April, when COVID-19 impacted all of us and came into our lives, our foundation knew that we needed to do something in response to this. So we asked our care teams within Island Health, what is the single greatest need that you need us to support you with? And the answer was clear. It was expanding critical care. And more importantly, getting a permanent high acuity unit in Royal Jubilee Hospital, because that hospital sees many people. 40% of the individuals that the hospital treats is actually outside of the Victoria area. And in the last decade, there's been a 73% increase of ICU patients. So it was clear to us that we wanted to do this for our community, and a gift from Seaspan Victoria Shipyards like this truly advanced our $7 million campaign. It has been highly rewarding working with this donor, and it is certainly changing lives, a gift of this size.
Find out more about what this unit does and what it means. But Joe, I want to go to you first of all. Seaspan is a huge organization. You guys are getting hit up all the time for money. People are probably asking you every day to do something for them. Why does this one mean so much? Why did you step up?
Well, I think it was stepping up, and again, it's just to trace it. Seaspan itself has been a proud Canadian company for over 130 years. However, through acquisition and such, it did become part of the Washington Group. Dennis Washington, Google it, he's a story by himself of how he built wealth from nothing. And again, as is when you see a lot of the wealthy people, they get to a certain stage where they're in the process of giving it back. They've created the wealth, and now they're sharing the wealth. So, and with the Dennis and Phyllis Washington Foundation, is they can give gifts of a size that can make an impact. So again, when you can bring to the table 7 figures, and this one turned out to be $2.65 million, you can move the needle on something. So just at that time, the March-April time period is popping up. We're looking for, okay, where would this have the maximum effect? Well, opportunity and need cross their paths at the same time. One of the first organizations we did connect with was the Victoria Foundation, and immediately they put that and other options on the table. And we thought with this, first of all, the incredibly worthy program, and the size of our gift could literally just move this forward and advance the overall cause and cut the time period down significantly. And again, as I always do it, is for those out there in the Chamber of Commerce, I challenge you, there's still $2.4 million left. Let's write some more checks and finish this thing off before the end of the year.
Good rally call. Thank you, Joe, for what you did. That's great. Dr. Ahmed, who's going to use this unit? Tell me about it.
Yeah, and first of all, just another thank you to Seaspan and to the Dennis and Phyllis Washington Foundation and Joe O'Rourke for being our champion. It's just means so much, and moving that needle forward, it's just so heartwarming. So thank you. Can't thank you enough from our team and from our patients as well. In terms of the unit is something that the benefits are just enormous. First of all, it increases our critical care capacity by almost double from what it is currently, and certainly it's been a need that's been coming for quite some time as we see people flooding to our beautiful island, to Victoria and beyond. And so our population is certainly increasing. So there's a great demand to increase critical care capacity. Of course, we have an aging population as well. And as we age, the medical comorbidities start to add up, and the need for acute care hospitalizations does go up. So there's significant pressures there. So this helps with that enormously. It also gives us great capacity to increase our care for those populations that are at severe risk. So those patients that are very, very sick but don't quite need critical care. So patients who may be recovering from major surgical procedures, patients who are suffering from cancer, severe respiratory distress syndromes, much like COVID is. Creating a lot of illness, substance abuse patients. Of course, we hear about that all in news. It's a huge population that we're now able to provide much, much better care for, and burns, among many other. I mean, I can go on to the subsets of patients that we'll take care of. As I mentioned yesterday, we've only been open for 2 and a bit weeks. We've already had 50 plus patients go through our unit. So, and this is just our interim unit with only 6 beds. Our full permanent unit will have 8. So you can imagine how many patients we'll be able to take care of and have our team provide that loving care that they come to work for. It also increases the flexibility for us to provide critical care through the COVID pandemic. We've learned and heard very clearly, provincially, nationally, and internationally, that a lot of these high acuity units that are available, is we sort of look at our critical care network as an entire family, and so we can flex between our critical care unit as well as our HAU, and it gives us our ability to sort of cohort COVID and non-COVID patients, and just gives us a lot of flexibility to give really good care. So it's been it's incredible. And so again, thank you. This is a huge gift that's going to give to patients in Victoria and across the entire health authority, because we see so many patients from the entire island population. So thank you again.
Thanks, Dr. Carey. This, I would assume, is going to enhance service in that it frees up other facilities for a more specific purpose. So this means that people are going to be given more intense care, not intensive, but intense care in other facilities. So how does this fit into the other facilities available in this region?
Oh, well, like Omar said, this gift and the opening of the HAU really will have a regional impact, because, of course, in Victoria, we are the tertiary center, meaning we have a lot of specialty services in Victoria that serve the entire island. And so increasing our capacity allows us to bring patients in a timely manner to the level of care that they require. So previously, we would have patients holding in the emergency department or in post-anesthetic care units, just because it was noted by Avery, the sheer volume of work that we've that's grown over the past decade. And so by increasing our capacity, we're able to pull patients out of those care areas at the time when they really need it, and to provide that very focused, multidisciplinary care that they require.
Doctor, how COVID specific could this be?
How COVID specific could our HAU be?
Yeah.
Yeah, certainly. I mean, and Carey's been very much a part of all this cohort planning, but as we start to increase our number of patients that present with COVID that need critical care, then we have the ability, we know from international experience, that separating patients into COVID and non-COVID units has really decreased the spread between patients and the risk to healthcare workers, and of course, by extension, to the rest of the community. And so the ability to make the HAU or the ICU, the COVID unit, and the other unit, the non-COVID unit, really is going to improve care as we move forward in this pandemic. And as we start to see numbers rise, unfortunately, quite significantly and exponentially in BC, this will be something that's going to be very valuable for us to have as an option to cohort patients and cohort patients safely.
So this $2.65 million gift from C-SPAN and the Dennis and Phyllis Washington Foundation, Joe, this was actually led by Kyle Washington, who was on site for that yesterday. So, you're doing the right thing all the way around, but I have to think that the employees and the staff at the shipyard must just burst with pride to know that they've been a part of making this gift happen.
Yes, again, as I actually took a look at the LinkedIn page and seeing how many of our senior staff and such commented on it, look, it is, we're an island people. There is an island culture here on Vancouver Island that now in my 6th year, almost the end of my 6th year, from stranger danger kind of attitude that we have in terms of here. But again, it is a special place, and it is a special organization. And I would say a large number of our people really get a sense of purpose and identity from working within the VSL's family. So yeah, it is just from private smiles to the thing is they take pride in the organization. They take pride of being part of Vancouver Island. And of course, as that extends on to is they just continue to believe that we all strive to do the right thing. And this is one of those right things to do.
Joe, you had the call to action to everybody at the beginning, but Avery, let's remind people once again how they can help you achieve the goal for this campaign.
Thanks, Bruce. Well, we know that our community wants to support our frontline and our hospital heroes. Now is the time more than ever to be giving back to healthcare and helping us advance healthcare. So we have $2.4 million left to raise. We know, to Joe's point, a gift as significant as 2.65, not everyone can do, but that's not what we're asking our community to do. Every single gift, small or large, makes a vital impact. So we would love to see this campaign close within the next few months. The sooner we close this campaign, the sooner we'll have a permanent purpose-built high acuity unit. So we have $2.4 million left to go. This is a very generous community. People can give back directly by visiting our website. And you can see more stories, patient stories, physician stories, and a little bit more about this campaign and what it'll do to operationalize those 8 new beds. So reach out to the foundation. We love hearing from you, and please consider donating. We've seen 2,300 people so far donate to this campaign, and we are so grateful.
Well, congratulations on all of this, and thank you for everything that you all do in our community for healthcare and providing jobs and everything that you do. This is an amazing project. Very proud to say that the Seaspan Victoria Shipyards, Island Health, and the Victoria Hospitals Foundation are all members of the Greater Victoria Chamber of Commerce, and we're proud to work with you on an ongoing basis. Avery Broman is the Executive Director of the Foundation. Dr. Omar Ahmed is the Head of Emergency and Critical Care for Island Health. Joe O'Rourke is the man in charge, the VP and GM at the Victoria Shipyards for Seaspan, and Carrie Homuth is the Manager of Intensive Care and the Acuity Units for all Victoria hospitals. Thank you all, and congratulations again.
Thank you.
Thank you.